So I'm here talking to Professor James Stone, consultant psychiatrist and neuroscientist at Sussex University. James and MTech have been collaborating for a few years on research into mental health disorders, particularly depression and imminently bipolar disorder. James, I'd love you to tell us a bit more about your clinical practice.
Sure. So in my clinical work, I work as a liaison psychiatrist, which means that I see people in the general hospital, a variety of different conditions, people who are presenting in emergencies, and people who've come in for other conditions who have psychiatric problems. So see a wide variety of patients, and particularly one of the biggest groups of patients I see are those with depression and those who present with suicidal thoughts.
It must be very challenging, and we know that mental health conditions are increasing. Huge burden just now, and obviously resources are limited. Tell me a little bit about how you assess a patient currently and what are the limitations of the tools that we used just now?
So the standard way to assess a patient is through just a straightforward interview where it requires talking to the patient and the patient to recall how they have been in preceding days and weeks. And this is a very powerful technique, but it does have its limitations. And one of the big limitations is patients may be unable or unwilling to recall certain aspects of their condition over the preceding time period, and this can make assessment more tricky. It can also make the assessment of people's changes in their condition after starting a new treatment more difficult. For example, when starting a new antidepressant, you might want to see the patient again in a week or two to see how their response has proceeded, and it can be quite difficult to understand it in great detail exactly how people have improved, and it's often more we use things like rating scales, which can give a snapshot data about how the person's feeling, but we don't know how they've been over the preceding time period.
That's fascinating. I mean, one of the things that's interesting is the way that in clinical care, things like diabetes or blood pressure measurements, we previously used to ask patients how they felt and ask them to recall their symptoms of being lightheaded, etc. And we didn't really have a good way of understanding really what that meant clinically. And we've now moved over to more objective, more continuous and more home-based monitoring systems. Is that something that you think would be valuable in psychiatry?
I think it would be extremely helpful in psychiatry, yes. Using wearable devices to provide more information about people's day-to-day activity could be very helpful, and I think it would be helpful to both clinicians and probably to patients themselves to have a greater understanding of their own condition.
Tell me a bit more about that, because that's something that always interested me about the aspects whereby patients could have a better insight into how they're doing. We know that patients with diabetes, for example, do a finger prick, and that gives them a chance to course correct, if you like, change their behaviours and improve their current health, hopefully their future prospects in avoiding complications of that condition. I guess obviously the complication of depression, the ultimate one that we most fear is suicide. Do you think there's a role there for technology to help patients have self-awareness around their mood?
I think it's certainly something that's very exciting with a lot of potential, and I think for many patients it's difficult to have insight into how they are from moment to moment, day to day, and having some kind of objective measure about measures that are related to their mood could be very helpful for them to track their progress of their condition, and also possibly to spot early warning signs of an early relapse.
Yeah, personally, my sister has bipolar disorder, and that's something that I feel very passionate about, because it's clearly something that can have very devastating complications for the individual. Talk a bit about the project that we did together. That was published in Frontiers in Psychiatry. We'll put a link in the description about that.
Yeah, so this was a study which we ran in a lab, and we used the OcuSense glasses in order to monitor people's facial expressions, while they were watching different videos with different levels of emotional valence. These were people who had a history of depression and who had different responses basically to people who had no history of depression, no depressive symptoms. And so we were able to see that people who had depression had a measurable difference in their response to these emotional videos, and this was detectable using the OcuSense glasses. So this was really a very early first proof of concept really that these glasses could detect differences in people with depression and could potentially be a marker of depression severity.
Yeah, I mean it's super exciting to me because it's a bit like I kind of keep going back to diabetes because it has a relationship to metabolic health. And one of our other advisors, Lisa Feldman-Barrett, talks a lot about the body budget and about metabolism and the brain and behavior. In a way, the study had a stimulus in the form of video. In the same way with diabetes, you give people a glucose challenge and you see how they respond, and the response is what you use to diagnose in that category, are you healthy or not healthy, and then hopefully later on the severity. So what do you think will be the next step in this research?
I think obviously using videos is a neat approach, but it's probably not very useful in a kind of longer term day-to-day usage. What needs to happen next, in my opinion, is that we need to collect large amounts of data in people with depression, people living with depression, in order to find out what the measures are that are sensitive to mood changes, they're sensitive to things like development of mania, for example, in people with bipolar, and also potentially are indicative of early warnings of a relapse of depression or of development of suicidal ideation. And these are all things that are very feasible to use with these glasses. We could leverage the vast amount of data that comes with the glasses to look at to use machine learning approaches or AI approaches in order to try to pick out these details from the data that can give us some real deep insights into the underlying mental health condition.
Yeah, I mean, I find it just so exciting, and it often made me concerned in a way when looking at research, how people develop new drugs, for example, how it's so important to have a good idea of what's actually happening. And if you're using surveys or tools that have perhaps low degrees of discrimination between levels of depression or even between depressed and non-depressed, could one use tools that are more sensitive to get a better idea, do drugs actually work?
Yeah, I think that again these glasses potentially could be used in monitoring response to drug treatments. So they could be used for existing drugs, for example, where a clinician might give a patient a new try a different antidepressant and then ask them to wear the glasses for a few weeks, and then they would be able to collect data that would be able to corroborate the patient's description of how things have been, and perhaps see that there were signs that their activities and their facial expressions were in keeping with improvement in their mood. But they could also be used in the development of new treatments for depression, and in providing huge amounts of very valuable biometric data and data about facial expression, which would be of great relevance to understanding whether a new drug treatment is similar to existing treatments or better in some ways, and to highlight how effective it might be.
Yeah. So our current glasses, well, the ones we used for the study were very bulky. This is the version that we're coming out with next. These ones are going to be focused on dietary behaviour. We're going to be miniaturising sensors to allow the face sensors to be within this sort of form factor as well. Diet is something that we've only really done more recent work on, but it seems to me, just doing the literature review, that there's a lot of work done on diet and mood. is that something that comes into your sphere of practice?
Well, I mean, it's even in the news today, isn't it? There was a report that low calorie intake may be associated with low mood, and so this is I think it's clear that food intake is clearly related to mental health. But yes, in my own work, I've been very interested in the role of gut bacteria in mental health. We did a study in people with depression in which we used probiotic treatments and found that when probiotics were added to conventional antidepressants, people were improved more quickly in terms of anxiety and depressive symptoms. So this is, and obviously gut microbiome is affected by what people eat as well. So this could be something that could be monitored through the eating behaviours aspect of the EcoSense glasses.
Yeah, wow. Yeah, I wasn't really that familiar with that work. I must look into that, because one of the things that I know when talking to patients about their diet, those patients who need to lose weight, for example, before surgery, I often ask them about their diet, their dietary behaviours, and even how much they're eating. And their recollection of the calories that they're consuming doesn't match what we're seeing in reality. And one of the things that we thought would be quite powerful would be to be able to use the glasses to detect that they're eating. Use the glasses downward facing camera to capture an image of the food, which can be analysed using our new AI tools, which surprised me how accurate they are. And then to, again, form a more objective log of their dietary behaviours, and then obviously in future correlate those to their activities and their mood.
Absolutely, I think that's very, very exciting work. I mean, it could potentially also be used in people with eating disorders as well. And also, I think the way the glasses work is that they can detect the types of food that people are eating as well. I think that's often more important than the actual calorie intake. So, avoiding highly processed foods and trying to eat more fruit and vegetables. This kind of thing could be really helpful for people to have feedback on their dietary intake on a daily basis.
Fantastic. Yeah, no, there's so much that can be done. Tell me a bit about the project you're looking to do in the next phase of the work.
Well, I think the next phase really is to expand the work we've already done in the lab and to try and use the glasses in people with depression over longer periods of time. So collecting data over several weeks. We want to look at how feasible that is, how people find wearing the glasses, feedback about their thoughts about the kind of data that they can obtain with the glasses, and also to see how well we can identify data that the glasses collect and how they relate to measures of depressed mood. So this will give us a real insight into the quality of the data that we can collect, and will then allow us to move to further down the line. We want to look at whether the glasses can be used to monitor improvements in mood with changes in antidepressant treatments, for example, which would be extremely helpful, and also whether they can be used to warn when people are becoming manic in bipolar affective disorder, because often people who develop mania are not aware of it themselves. So it's actually a pleasant state to be in, but it can cause tremendous harm to themselves, and they can do dangerous things, and so having an early warning for that could be extremely helpful, and we know that if people are treated early in the early stages of mania, then things like hospitalisation can be avoided, which is obviously fantastic for everyone, not least the patients themselves.
Yeah, I mean, so much to be done, and I'm super excited about the work that you're doing. You know, I thank you, given your clinical workload is tremendous. You have a very busy academic program as well, with PhD students you're supervising, and doing this exploratory work, which obviously is difficult sometimes because applying for funding for this very new work can be difficult. So yeah, thanks so much for your work in this area, pushing the field forward. You know, I was recalling how long it took for the thermometer to be adopted into clinical practice, which was something like 200 years. So hopefully we'll push psychiatry forward at a slightly faster pace.
Absolutely, I hope so too.
Thanks so much, James.
Thanks so much.
Well done, everybody.
You good? Is that a wrap?
Yes.
Great. Hit stop.